This conference will now be recorded.
Good morning. We'll wait another minute and see if anybody else logs on. Anna, do you know if Judy RSVP'd? Here she is. Okay, well, it's 10 o'clock. We'll go ahead and get started for the COVID-19 news conference with the hospitals. And welcome everybody. Tom Bennett is out of the office this week, so I'm going to do my best to fill his shoes as moderator. So thank you for your patience with that. And we'll just go ahead and ask our hospitals and public health to provide an update. Is anybody dying to go first? I'll let Jason take the reins if you want to, and just if you want to give a quick update on what's going on.
Sure. I think I can't speak for everybody else, but we're pretty grateful right now. We're seeing a decrease in cases. We're seeing a decrease in our census. Things are much more manageable right now. We feel like we've got some breathing room. And then even for us in those situations where we might need to transfer somebody into Portland, it's much less of a wait than it was before. So I think we're, I don't want to jinx anything. I'm a little superstitious, but I feel like we're in a much better spot than we were the last time I was on this call, for sure.
And Judy Taggart with Providence.
Yeah, I would agree with Jason. We are seeing a reduction in the number of COVID patients that we are seeing. We still have, as of today, 4 inpatients with COVID. So we're still seeing some. Our ED volumes are stabilizing. They're not always as high as they were. And in some circumstances, we're able to transfer a little easier to the Portland area when patients need it. We're still seeing some delays in certain types of patients, like those with mental health issues. We still can't get patients into long-term care appropriately. So there's still some delays there, but it does feel better overall than it has. So, yeah.
Thank you. And Margo, you're up with public health.
Yeah, good morning, everyone. Nice to see you again, Jason and Judy. Yeah, I concur. It's nice to see that the number of cases are decreasing. I was just checking, our positivity is about 9% right now, which is much higher than we'd like it to be, but it's definitely decreasing. We're seeing less of a demand for testing as well. We continue to stand up operations, and we'll continue to provide daily testing at Camp Riley Monday through Friday for the duration maybe with some reduction in hours, but ready to scale up at any point in time if needed. We're also closely monitoring what's happening in our school setting, and the schools are doing a very good job managing their students and cases. Very pleased with that cooperation in our community as well. We are in the process, again, working with our hospital partners to make monoclonal therapy available in the community, and expecting that to go live here relatively soon, working out the procedures for that. And then we are, again, preparing for our vaccination clinics going forward for both Pfizer as well as Moderna. And so we have some tentative dates scheduled for that as well, and just waiting for the green light from our respective agencies. So I think that's it.
So, Abby, it looks like you are the only media representative that is in the conference. Did you have any questions that you had for anyone?
Yeah, thank you for that. It feels like my own personal press conference. I was hoping to follow up on the monoclonal therapy aspect, and I was wondering if you had a timeline for that, or maybe additional details people might want to know about that as a solution or treatment.
You're muted, Margot.
So I'll speak to how we're setting it up kind of structurally, and then defer to my hospital colleagues in terms of how they are staffing it and supporting it, and kind of their perspective on the provision of this intervention. So we are doing it at Camp Rylea. We're setting it up in Camp Rylea, as we are our other operations. We have our public information call center that continues to be busy and well-staffed, thanks to all of our volunteers. We have a permanent testing site, as well as we'll be doing drive-through vaccinations there. And now we have a space for the administration of the monoclonal therapy. We're planning on doing it 2 days a week in the afternoon. Again, it will be, I think, Tuesday and Fridays. Again, we're working out the procedures in terms of, requires a screening. It's an order from a physician, and so our clinical partners are helping to set that up. And again, like all of the other services we've made available as a joint operation, both testing and vaccination, the most important thing is getting it to members in our community who are eligible. It will be first come, first serve. And at this time, there are allocations of the monoclonals to our community. And we have two pharmacists who are been working together throughout on the vaccine task force that are coordinating this piece of it. So we haven't published the finalized dates because we are working through some of the administrative pieces, but we're anticipating towards the end of October being able to make this available in the community. I'll defer to Judy and Jason to speak respectively from your health system. So maybe Judy, I'll just.
Yeah, I apologize. I don't know any of the specifics. Chris Lehman's been doing most of those, and so I don't have any other updates about what we're doing. I can sure get some information needed.
Yeah, Chris Lehman has been a part of this, as well as Julie Owens from Providence Seaside Hospital. And as you may know, Chris has been integral to the launch of all of these operations throughout the pandemic. And so he is the lead pharmacist representing Columbia Memorial Hospital and making sure that we set up all the protocols in full compliance with the requirements. Jason?
Yeah, I think what I can speak to is, I think it's just a great partnership with CMH and Clatsop County, and I think it sounds like my understanding is we're gonna divide up staffing. So Seaside has agreed to staff it on Tuesdays, and then CMH is going to staff it on Fridays. And yeah, we've got a process in place, and we're just really hammering out those last few details. Julie's been doing a great job, and so is the pharmacy counterpart from CMH. I'm excited about this. I think this is a great opportunity for our community, and it's going to keep people out of the hospital. That's our big goal, right? Treat them and keep them out of the hospital if we can. Yeah. So thank you.
And just to follow up on that with Margot, why is this the particular therapy that the county has decided to invest in?
Well, because it's what's available to us. There's a federal allocation to each state of therapies, and while there are different types of therapies, this is the one that we are going to be administering. And I actually don't want to get into the clinical parts of that because that's going through the pharmacy. It's an allocation, and so we're making this available to the community based upon the allocation that Clatsop County is receiving from Oregon Health Authority. And again, they're distributing the monoclonal therapy to various counties. Tillamook is also actually through Adventist Hospital. They have been making this available as well, and their Medical Reserve Corps is as helping to support that operation. It's what's available, and so we're just working together to create an implementation plan so that the community can receive it, keep them out of the hospital.
Gotcha. Thank you. I appreciate it. And I just have one follow-up question, then I'll let everybody go. But I was hoping, I've talked to some people independently about this, but I'm working on a story about healthcare workers. I'm seeing a lot of openings on like Craigslist and Facebook and all these things. And I was wondering, does Clatsop County have a healthcare worker shortage? And if so, what are you doing to protect your workers from overworking and to seek new applicants?
I can start if you'd like. I would say we are just like the rest of the country seeing a larger vacancy rate in healthcare jobs that is higher than we've seen in the past many years. People are reevaluating their lives, I believe, because of the pandemic and choosing to leave healthcare settings in larger numbers than they normally would. So we're working on some plans for recruitment and retention. I don't have details to share today, but we are trying to support our caregivers who are here and support bringing in new caregivers to fill the open positions.
Yeah, I would just echo what Judy is saying. I think nationally there's been struggles to hire into the healthcare field, and it was even before the pandemic hit. And then once the pandemic hit, it really exacerbated that situation. And so, yeah, we're just being creative about hire on bonuses and creating opportunities. And I think the nice thing for hospitals like Providence, Seaside, and our counterparts at CMH is that we offer things that other hospitals don't. We have that opportunity for nurses to work all over the place. So we try to sell those positive aspects, right? Like if you go to a big hospital, you're going to be kind of pigeonholed in one spot. You come and see us, we're going to give you an opportunity to work. There's all sorts of opportunities. So I think just trying to, sell ourselves really as an ideal place to come and work. And so far we've been doing okay. We don't have a lot of holes, but yeah, we're making it work.
I think Jason's right. One of the things that the pandemic has taught us is that we need to be very flexible in what we do. And we do have a great opportunity in smaller hospitals like ours to have people learn skills that they didn't have before. It keeps them engaged, or it can keep them engaged, and it also I guess it keeps you from getting bored in what you're doing. But it's good, and it's a good professional move. Jason's right.
Yeah, I think, it's, your comments made me think of a couple things, and always in public health, it's a challenge, and part of it is it's a unique discipline that has been an integral part of aspects of sort of what is now being done in primary care. But it's, recruitment has always been a challenge, or actually I would say in the last probably 2 decades in public health. It's taught in school, but once people enter into the public health workforce, particularly the nursing side of it, they realize how little training they've had for it in nursing school because it's so clinically focused, and in public health, the population's the patient. And so, but what's interesting right now is because of the pandemic, there's been this sort of migration and intrigue into what public health really is, or what it's always done. But I also think this is an upstream issue when we think about the nursing shortage. And I say this from formerly being on the board for the Oregon Center for Nursing. We do a lot of the workforce research, is that, there was a time when going into nursing per se was, and I'm speaking specifically of nursing right now, but of course there are other disciplines, but it was really a calling, a vocation. And then it became very alluring and attractive because of the diversity of opportunity, because of the compensation, everything that both Jason and Judy had mentioned, the flexibility. And so it was like, it went from vocation to like, what a great job, or like a second career. But what happened is the number of clinical spots started shrinking, and the faculty started shrinking, and so the opportunity to accept more students into nursing programs decreased, and it had this compounding effect, and it really has been over the last couple decades. And so part of the reason there was a nursing shortage and it has sustained itself is because we have a nursing faculty shortage across the country. There are so many vacancies. And so there just isn't the faculty to educate the students, and then there aren't the clinical spots. So it really is an upstream issue that I think Oregon, as well as other states, are trying to address. But I would concur with what Jason and Judy say. And I say this when I'm talking to individuals, whether they're nursing or in other disciplines within public health. In our community, we're big enough to have everything, but small enough where everything feels very tangible, where you can really connect with the community, whether you're in a hospital or clinic setting, or you're in the public health community setting. And it makes it really, really attractive. And for people who want to get a very holistic kind of professional experience, this is a very attractive community to be working in. Whether you're in the public health side or in the hospital setting, there's no question about it.
Besides, it's in a beautiful setting.
Mm-hmm.
Excellent. Abby, do you have any other questions?
No, that covers it. Thank you for taking the time to respond.
Any last comments from Judy, Jason, or Margot?
No, thank you for this opportunity. Appreciate it.
All right.
It's my comment would be that it's just, I think we're all sort of with a little bit of apprehension and tentativeness, just taking a little bit deeper breath, but we've been doing this long enough that we don't want to get too comfortable, right? But also there's just a little bit of calm, right, that we're experiencing. And so I think it's just giving us an opportunity to take a deep breath and yet prepare ourselves for what's coming with winter, and And we have multiple operations going on, and just again, working together to prepare for that. So
It's true, we can't get complacent. Flu season is just around the corner.
right. That's right, given those flu shots.
All right, well, if that is it, thank you all for attending and coming, and we'll do another one in 2 weeks.
Sounds great.
Thank
Thank
you.
you. Nice to meet everyone.
Thanks, everybody.